Good morning. Thank you for attending. Today I'm joined by Andrea McLellan, Director of COVID-19 Immunization Strategy, who will provide an update on the vaccine rollout in our district, as well as Louise Gagné, Executive Director of Community Services. And she'll provide an update on our local COVID-19 situation. As of tomorrow, June 11th at 12:01 a.m., the province will be entering step 1 of the roadmap to reopen. This step 4 means some restrictions will be lifted, and outdoor gatherings of up to 10 people will be allowed. This also means that non-essential businesses can open at 15% capacity, and outdoor patios may operate with some restrictions. This comes as a sign of relief for many individuals and businesses. We want to take this time to remind people to be kind, to be patient, and to still be cautious as COVID-19 and its variants, including the Delta variant, which are very much still out there. We need to move slowly and cautiously to ensure that this is our last shutdown. So we encourage you to follow public health measures and get vaccinated. With that, I'd like to now hand it over to Ms. McLellan to provide an update on our vaccine rollout this week.
Thank you, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we now have 70% of adults 18 years of age and older who have received at least one dose of COVID-19 vaccine in our district. Additionally, 24% of youth aged 12 to 17 years of age are now vaccinated with one dose of the COVID vaccine. Also, as of yesterday at 3 p.m., we have provided 82,729 vaccinations in our district. As of Monday, individuals 70 years of age and older, as well as individuals who have received their first dose of COVID vaccine on or before April the 18th, are now eligible to book their second dose of the COVID vaccine. This is part of Ontario's accelerated rollout announced by the province to have Ontarians fully vaccinated by the end of the summer. We know there has been a lot of information about second doses announced recently, and this can be confusing. Our call center staff can help you determine if you are eligible to receive a second dose. Earlier this week, we issued a public service announcement to notify the public of a glitch in the provincial booking system that has resulted in some individuals having second dose appointments booked on dates when clinics are not scheduled. We recommend that everyone visit our website and ensure their clinic date and time coincide with our district's vaccine clinics. Individuals can change their appointment online at ontario.ca/book vaccine or by calling the provincial booking line at 1-833-943-3900. Youth aged 12 to 17 continue to be eligible to book their appointments in our youth clinics, as well as our regular mass immunization clinics across the district. Finally, it has been brought to our attention that children and pets have been left unattended in vehicles at our clinics. As the hot weather approaches, we wish to remind the public of the risk of doing this and to ensure that they have plans in place to ensure the safety of their children and pets while they receive their vaccine. And I'll turn it back over to you, Dr. Chirico.
Thank you, Ms. McLellan. And now to Ms. Gagné, who will provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we have had 17 new cases, bringing our total case count to 472, with 303 in the Nipissing district and 169 in the district of Parry Sound. The health unit currently has 22 active cases, of which 2 are confirmed as being the Alpha variant of concern. This week, we have seen daily provincial cases reach totals under 500 for the first time since last September. As for our local cases, overall, they continue to decrease as well. However, over the last 7 days, we have seen clusters of cases, and the most frequent exposures are close contact of a case and community acquired, meaning that the individual is not sure where they were exposed to COVID-19. In addition, we currently have 2 active cases in hospital. As Dr. Chirico said earlier, the province announced that we will move to step 1 of the roadmap to reopen. The province has announced that brief outdoor end-of-year celebrations and graduations for public and private elementary and high schools can be organized by the school with some restrictions. The 4 school boards in our district have been liaising with us on their graduation plans to ensure that public health measures are complied with while still offering a unique experience for their students. To help everyone navigate through their favorite summer activities, the Health Unit is launching a COVID-19 Guide to Summer Activities webpage. This webpage will provide advice on various topics, including how to host gatherings in a safer way, enjoy outdoor sports and activities, garage sales, and more. We also have a new summer camp webpage under the COVID-19 section of the Health Unit's website that will be updated regularly as we continue to move through the stages. This page provides day camp and overnight camp guidance for parents and camp operators. Any questions can be directed to our call center. With that, I will hand it back to Dr. Chirico.
Thanks, Louise. And that ends our prepared remarks. So we'll take questions now. And if you can just put them on the top of the Q&A and attach your name if you can, and we'll get moderated to start with the first question, please.
Thank you, Dr. Chirico. Our first question comes from Jennifer at the Nugget and is a question for Louise. Do we know if those who are testing positive have received at least 1 dose of the COVID vaccine, or are they unvaccinated?
Well, I could probably help you with that one. That is an excellent question. And what we know is that the Delta variant is one that is increasing significantly within the province. And there was a study that was done, and it was dated from December 14th, 2020 to May 15th, 2021. And it looked at patients that ended up with positive test results, but had been vaccinated. They found that it was actually very, very low, that people that had the first dose of vaccines, it was only 0.15% of them that actually tested positive. And that 56% of those, they had a symptom onset less than 14 days. So they weren't really at a period where they were fully protected. And then if somebody had 2 doses, they found that it was even lower, that only 0.05% or 1 in 2,000 would test positive. So the vaccines are very effective.
Thank you. Our next question is for Andrea from Eric at CTV News. What is the percentage rate of people in our health unit district that have 2 vaccine doses?
Our current the current rate is 8% of those 18 years of age and older.
Thank you. Next question would be for Dr. Chirico and is from Clark at Cogeco News Your TV. Do the COVID vaccines currently approved by Health Canada protect against variants which are currently identified? So you did answer this a bit, but if you'd like to elaborate a bit more.
Yeah, excellent question. What we're finding is that, and more specifically to the Delta variant, is that there are some differences in vaccine effectiveness. They found that after the first dose, that the vaccines are about 40% effective against the Delta variant, and then after the second dose, about 90%. And that's a little bit different than the Alpha variant, where it was after the first dose 60% effective, and after the second dose, about 90% effective.
The next question is from Tom at Radio Works Parry Sound for Dr. Chirico. Again, with variants of concerns originating from Brazil now in the Nipissing district, is there a VOC that is the most worrying, and if so, why?
I think that all of the variants, and I think, again, we want to stress that simply because the measures are being lifted, we have to still be vigilant. We want this to be our last shutdown. I think there's some really positive indicators within the province and within our district, and that the case numbers are coming down, and that's all very, very encouraging. But we also have to really think about and use very good judgment with the loosened restrictions, because the variants are still there, and we have to keep a close eye on all of the variants to really see what direction we're headed in. We want this to be our last shutdown, so please be vigilant. Please, follow public health measures, and I think that in doing so, we have the best chance to make this our last shutdown.
Thank you. Our next question is for Louise from Jennifer at the Nugget. Are any school boards organizing outdoor graduations? And if so, what does that look like?
Thanks, Jennifer. So we have been working with our 4 school boards on their plans with respect to graduations, and we are expecting that the school boards will be making their announcements today to their school communities with respect to their plans. There are a number of options that the schools could look at in terms of hosting graduations, and our school boards have chosen those that work best for their school community and will offer a unique experience for their students, but still adhere to public health measures. So I'll defer to the school boards to make their announcements with respect to how they're hosting their graduations.
Thank you. Our next question is for Dr. Chirico from Chris at Bay Today. Any concerns over the latest COVID situation at the police station?
Well, we work with the whenever there is a positive case, we do case and contact management and follow up and identifying certainly any individuals that would be at high risk. So, no, all the measures that we normally follow are being followed, and we work with any organization in doing case and contact management. So, all being looked after.
Thank you. Our next question is for Louise from Rich Coffin at Moose FM. What is the key message with the Guide to Summer Activity website?
Thanks for that question. It really depends on what step we're in with respect to the roadmap to reopen. But really, people need to continue to keep following public health measures, staying home if they're experiencing any symptoms, seeking out testing, wearing their masks, maintaining social distancing, really making smart and using smart choices and using good judgment. As well, we really don't want to go into another shutdown, as Dr. Chirico mentioned. So we just need to be cautious as we move forward with opening up, and then hopefully this will be our last shutdown.
Thank you. Our next question would be for Dr. Chirico, and is from Brad Obey and Moose FM. With sub 500 numbers announced provincially, and with a high percentage of those numbers isolated in a handful of health unit jurisdictions, is there a sense of relief amongst medical professionals?
That's an excellent question, and I think that it's a bit of both. In that there is a sense of relief that we're headed in the right direction. There is really good indication to be optimistic if we continue to use good judgment. The numbers are coming down, hospitalizations are coming down, and as you indicated, there are certain areas that are a little bit worse off for sure, and that's why we have to be really vigilant in monitoring it and to look at what this variant is doing and how quickly it spreads. And I think that we need to continue to follow the public health measures to keep the numbers low. So yeah, it is concerning with some of these cases, and that's why we're moving slowly through the steps so that this is our shutdown, and that we can get back to a more, certainly get more vaccines into people, so that will certainly help as well. But right now, we really have to rely on the public health measures.
Thank you. Our next question is for Andrea and is from Eric Tashner at CTV News. A follow-up about what you said of people leaving pets, young children in their car when getting their dose. Have there been any severe instances about this?
No, there have not been any severe cases with respect to this. It's just a reminder for people that as the hot weather comes, to make sure that you're not leaving pets and children in a car while you're attending a vaccine clinic.
Thank you. Another question for you, Andrea, from Chris from Bay Today. Some locals are feeling more side effects from the second dose. Is this typical? And maybe give your take on this.
Thanks, Chris. That's a great question. Yes, we did anticipate that there would be increased side effects with the second dose. The research certainly supports that. For the most part, the side effects are headache, just a general feeling of unwellness that usually lasts no more than 24, 48 hours in most individuals. Each individual will react differently to that, but I'm not aware of any major side effects that anybody has had or anybody who's had prolonged side effects following their second dose, but it is definitely more common with the second dose than it was with the first dose.
Thank you. The next question is for Dr. Chirico, comes from Jennifer at The Nugget. Is there any projection when residents can stop wearing masks and social distancing?
Yeah, that's $1 million question, Jennifer. Thanks for that. And thanks, because I don't have a good answer for you. We don't know, and that's the bottom line. It's really too early to say when those measures can be relaxed, because they're certainly dependent on many factors, such as the circulating variant at the time, how quickly it's spreading, how transmissible it is, and as well as vaccine effectiveness. We also have to be able to determine what herd immunity is, and that's how many people are immune because of getting infections or having vaccinations. So there's a lot of things that have to be taken into consideration, and especially too, at the time, and it changes. How severe is the illness that is produced by these variants? So I wish I had an answer for you with that, but it's been yet to be determined. So what we do is we will follow the guidance of the science table, Public Health Ontario, the scientists that have the infectious disease experts, and they will let us know when they feel that these measures certainly can be eased up on.
Thank you. Another question for Dr. Chirico from Rich Coffin at News FM. Any disappointment with the provincial reopening starting tomorrow? Should the province have waited 3 more days and reassess?
Well, I really don't know the answer to that. You can't really tell. I think that moving forward, that we really need to, again, make this our last shutdown. So we need to move slowly and cautiously and continue to monitor the situation. As mentioned in previous question, there are some health units that are showing more cases. And so we need to really keep a close eye on them. Just move slowly.
Thank you. Our next question is for Andrea from Jennifer at The Nugget. Has a new location for the mass vaccination clinic in North Bay been determined? Previous interviews, we've heard Memorial Gardens will be installing ice at the end of July.
Hi, it's a great question, Jennifer. Thank you for that. We have negotiated an extension at Memorial Gardens until later in August, towards the end of August. We continue to do some site visits and determine appropriateness of some venues for our vaccination clinics to move to, and we do have a couple of promising sites, but I can't at this point in time share that information.
Thank you. Another question for Andrea from Mo at My Parry Sound Now. On side effects from both doses, can you provide a short list of the most commonly experienced ones? And of course, how do you deal with it if you do experience them?
Great question. I think the most common side effects are headache, some nausea, general feeling of unwellness, and you know, body aches and discomfort. Pain at the injection site are the most common side effects that people are experiencing. And I mean, listen to your body, rest, take Tylenol or Advil, whichever, if you're experiencing headaches or body aches, that may help with that. And it just takes time for the side effects to pass. I'm not sure.
I also want to add to one of the biggest ones that we're seeing too is fatigue. That is very common in after especially second doses. And usually, you know, as Andrea mentioned, that the symptoms will last 48 hours, and it's self-limited. There have been no indications of any increase in serious side effects from the vaccines and after the second doses.
Thank you. Our next question is for Dr. Chirico from Jennifer at the Nugget. Do you support the federal government's decision to change the Quarantine Act? Those vaccinated with 2 doses no longer have to vaccinate or isolate at a hotel or quarantine for 14 days. Do you have any concerns with the possibility of the US-Canada border opening this summer?
Well, I think that it really speaks to the effectiveness of the vaccines. And so I think that when people have legitimately gotten 2 doses of vaccine, that for the most part, they're very effective in helping to prevent serious illness and disease. So it's a federal decision. And with regards to the vaccinations, providing that people have been fully vaccinated, I think that, you know, that's a reasonable approach.
Thank you. Again, for Dr. Chirico from Chris at Bay Today, any updates on the Mary River Mine outbreak and what we can learn from that outbreak?
We certainly have had a significant number of those cases. We're still following up, and it's not over. I think that you really would have to contact certainly where at the mine to determine what they've learned from that and the precautions. But all we can say is that we followed up with our cases and the contacts, and that it really does speak to that you really need to have people following all the public health measures and precautions when people are working. So that's a significant factor, and that we certainly have learned throughout the pandemic in workplaces that you have to be vigilant, and it can spread very quickly and very easily. So that's where we are with that, and we continue to follow it.
Thank you. Our next question is for Andrea from Jennifer at the Nugget. Is there one vaccine more effective over another? Is Pfizer more effective over AstraZeneca or Moderna, for example?
Great question, Jennifer. The 3 vaccines that are available in Ontario all provide effective coverage to prevent severe illness and hospitalization. And our recommendation continues to be that people should access the first vaccine that is available to them to receive at a clinic.
Thank you. A question for Dr. Chirico from Eric at CTV News. As follow-up to Jennifer's question earlier about masks, do you, Dr. Chirico, think masks should be here to stay, especially, for example, during winter months, for example, when flu season kicks off?
Excellent question. I think, you know, if you look at other countries, and especially Far East and China, that's a regular part of their life. As far as in flu seasons, if people are symptomatic, that yeah, you certainly should stay home from work. It really depends on what we see that's circulating. There's a number of factors. If it becomes something similar to what the flu season is, and that you're not seeing really severe disease, and it's the usual then I think that it's a precaution that certainly you can take to use it. It helps, with preventing of spread and protecting yourself. So I think that it really is going to depend on the situation. I think that a lot of things will have changed in the way we do things and our behaviors, and so I think it would be helpful. But is it fully necessary? I think only time will tell if that would be something that would be recommended or not.
Thank you. We have a question for Andrea from Mo at My Parry Sound Now. We've heard some reports of people developing a swollen lymph node under their arm, mostly women. Apparently that's common with the second shot, and MDs are recommending women have mammograms either 2 weeks before their second dose or 6 weeks after. What's the health unit's input on this?
I think that if women are seeking medical attention for issues like that, they should be following the recommendations of their physician. I'm certainly not in a position to say whether physicians are providing appropriate medical advice or not. That would be based on the individual that they're assessing and what their medical advice is. I'm not sure if Dr. Chirico wants to add anything to that.
No, I think that that's something you need to follow up with your primary care physician.
Thank you. We have a question for Louise from Eric at CTV News. Is the North Bay Regional Health Center still accepting patients in ICU from other health unit regions? If so, how many patients have been brought here or are here from other districts?
Thanks for that question. I'm not aware of their intent to continue having patients transferred. You'd need to follow up with North Bay Regional Health Centre on that. I am aware that they currently do have one transferred patient, however, in their care.
Thank you. A question for Dr. Chirico from Jennifer at the Nugget. Those who are traveling for essential reasons are required a PCR test. Where can that be done, or do they have to pay for that privately?
No, I don't believe that you have to pay for it. All testing is free, and that you would arrange that through the testing centers to get it done and get your result.
Thank you. This will be our last question and is for Dr. Chirico. It is from Mo at My Parry Sound Now. Can you provide any more non-identifying details on the Parry Sound's first case of the Delta variant? How does it affect how you approach the rate of spread of the virus in the region now that a much more transmissible variant is in play?
Yeah, I think that you raise a really good point, and it really reinforces what we've been saying before. Is it simply because we have restrictions that are in place now that are opening up? I think that we need to really be vigilant that, yes, there is a circulating variant. The numbers are coming down, which is all very positive. We have to keep a close eye on it. So people need to continue to follow the general public health measures to ensure that you are adhering to the gathering limits, that you're wearing a face covering, and you're keeping the 2 meter distancing. Until people get vaccinated and we have a sufficient number in the population, we need to follow those public health measures. So to answer your question, nothing new needs to be implemented. People just have to follow what they need to follow. And that's the best protection, to assume, again, that everyone you have come in contact with would have it. And that's a good cue to remind yourself to follow those measures.
Thank you, everyone, for joining us. That marks the end of our press conference this week. Again, a reminder that the recording of this press conference will be posted on our website, and we will see you next week for our next weekly press conference. Thank you, everyone.